Well, good afternoon. I apologize for having scheduled this in the middle of the Eagles game. If you are understandably watching the Eagles game, I would imagine that you can catch this afterwards. Uh, this is recorded through Facebook and available through Facebook afterwards. So please feel free to view it there. I am Delaware State Representative Paul Baumbach, serving the 23rd House District, which is in Newark, Delaware, west and north of town also. And as I did last weekend, I'm hosting this to describe the state retiree healthcare plan, what has happened, what is happening this moment, and what is likely to happen in the future. Please do not hesitate to place comments and questions in the chat. I will be looking at that as we go through here. I'll be doing a little bit of repeating of what I did last weekend. I will provide an update on Senate Bill 29, which is now law. You don't need to know what that is. I will cover it. And again, I will try to my best to field your questions and comments. So with that, I'm going to bring up, let's see which one I want to do. I'm going to get to Adobe, and we're going to do that one. So as I did last weekend, I'm going to review again a presentation that the governor's office shared with us. That's not big enough now, is it? That looks bigger. It was that 2.5 weeks ago on the state Medicare pension healthcare. And I think it really does a good job of going through some of the top items. So MedicFill is the name for the current system. It is a Medicare supplement plan. So when you have if you're a retiree covered by this and you have a health cost, it will first go to Medicare. And if Medicare doesn't cover it, it'll then go to this MedicFill program. You can see it covers somewhere around 30,000 pensioners and spouses. And it's provided through Highmark. They administer it. So there was a plan that was announced last year in a meeting in, I think, February. It was shared with retirees who were affected, I think, in early June. It had a tortured path at that point. There were lots of public hearings held in late June, late July, also August, September, October. A lawsuit was filed, and then a judge with the Superior Court halted the planned change for 2023 from the MedicFill program to a Medicare Advantage program. Medicare Advantage is a class of Medicare supplements that are authorized through the federal Medicare system. It has some unique features, and in the lawsuit, there were arguments that it was not done properly. The proposed change was not done properly, and the court concurred and halted it so that the court required that MedicFill be continued through 2023. The state then renegotiated with Highmark because the contract was expiring on December 31st of last year. So it's extended through all of this calendar year. So that brings us to the end of last year. Let me see what our next slide is. It is quite expensive to run the MedicFill program. You can see $70-80 million a year above what was put in there. But that is what we're doing this year. Do keep in mind the state is run on a fiscal year that begins July 1st through the following June 30th, and the healthcare plans are done on a calendar year basis. So we're talking about the calendar 2023. This chart was shared and points out on the third row down for Medicare retirees and pensioners. The premiums are covered essentially 100% by the state, with no share for the retirees and their spouses. That 0.4% is if you didn't work a whole lot of years with the state, you pay a piece, and it rounds out to be about 0.5% of the dollars of premiums are paid by the participants, and over 99% by the state. And you can see that current active employees pay about roughly a fifth, almost 22% of the premiums. and different other percentages. But what this shows is that the entire premium cost is on the state, or essentially all of it is on the state for our retired pensioners and their spouses. And that means that as costs rise, that all of that flows to the state's obligations to its budget. So with that, and therefore it's not too surprising that it's been going up sharply. It's essentially doubled in the past, it was at 12, 14 years or so. It's flattened a little bit with, I think, largely with the pharmacy benefit manager and maybe some other changes in there. So the state has been doing some things to try to keep the cost from going up too high, too fast, but it's still at a very high level. So there are the state borrows money for things like highways, and there are bond rating firms. Moody and Best are two of them, and they look at obligations of the state and to see how much funding is set aside for those obligations. There's a profession called being an actuary who measure this. And they try to identify what the costs, what the obligations are, and how much is set aside. They project in 20 years that the obligation, OPEB, is the other personnel and employee benefits, non-pension retiree benefit obligations, and that the state's going to owe close to $24 billion, and all but about $3 billion of that is likely to be set aside on the path we're on today, which is a very, very low level, and that causes those bond rating agencies to consider downgrading our state from AAA. We're one of a fairly small number of states that has maintained a AAA rating for many, many years, including through a lot of financial challenges. And this will make, not only is this a gigantic problem for our retirees, but it's also a problem for all of the state operations if it costs more to run the government when it borrows money. So this is, you can just see that, let me see, what is this showing, the deficit? So the cost of providing healthcare, both to current employees and retired employees, is expected to keep rising if we do not do things. The state is doing things. Current employees are going to be seeing their premiums rise regularly over the next few years to try to bring this to rise less going forward. But again, as you can see, the state does not really charge any premiums to retirees. So that rising cost is now something that can be brought down through raising the premiums of the participants for retirees. So it's a bit of a unique situation for our retirees. And so there's three classes of approaches to address this for the state's retirees' healthcare that the administration laid out and presented as three columns. It can be put on the shoulders of taxpayers through putting money from the budget towards it. It can be put on the shoulders of current and future retirees by making changes to what benefits are delivered and what structure. And Medicare Advantage is one such choice, but there are many others that it can be done. And then it can be done on the shoulders of current employees and have reduce the promises, reduce the delivery for instance, spouses maybe who are working, not getting benefits through the state. Other things to be done through active employees, but truly, I think it's quite appropriate to look at this as not a single column solution, but rather let's choose some from column 1, some from column 2, some from column 3. But importantly, there are many ways to address this problem. Each of them, each change that the state considers will be designed to decrease the liability 20 and 30 years out, or increase the reserve towards that liability, or both. And what do we have here? I don't want to go for Medicare Advantage. So that was their presentation. That brings us to, let me see if I want to see. Yeah, I want to throw this up. So the governor on Thursday presented his proposed budget for fiscal 24 that would begin in July 1st of this year. And one slide from that is almost $200 million, and we have about a $5 billion operating budget. So that's a good hunk. Uh, and so almost $200 million is going towards state employee health care and the post-retirement retiree employment benefits. About 140 million for the shortfall with our group health for, again, current and retired employees. And then an additional 51 million, which is 1% of our budget, second year in a row, going directly to that fund, the OPEB trust fund, if you will. And that is something that the administration started last year, approved by the legislature. And that is a significant piece. And keep in mind that 50 million, actually both of these things, that's not the one I wanted. That's not the one I wanted. That's the one I wanted, but let's go back. Both of those, that 200 million is all here on the left side. This is coming from the budget, which is funded by taxpayers. So without making any changes here, the governor is proposing that almost $200 million in the upcoming budget go towards current and retired employees' health care. So that's in the budget. Now, let's talk about Senate Bill 29. Senate Bill 29 was passed by the Senate, I'm going to say last week before, let's say roughly 9 or 10 days ago. It was passed by the House this past Thursday. It was signed by the governor this Friday. And I want to go through it top to bottom. The sponsors of this were the 10 elected by legislators, elected leaders of the 4 caucuses. We've got Republicans and Democrat, and we've got House members and Senate members. That equals 4 caucuses. These are the 10 leaders of those 4 caucuses. They together sponsored this legislation. It begins with whereas clauses. I don't mean to be callous about it. They mean nothing. They have no bearing on the bill. They they're sort of like the summary of a book on the back cover. They give you an introduction, but they don't have bearing to the plot. What matters is after the whereas. So I'm going to jump through a whole bunch of it and get down to therefore be it enacted. So there are 2 entities that are involved with healthcare benefit plan selection. The overall one is the SEBC, the State Employee Benefits Committee. And then it has a subcommittee which has looked at things. But let's first talk about the SEBC. So it includes the Lieutenant Governor, Insurance Commissioner, Chief Justice, Supreme Court, State Treasurer. The Director of Office of Management and Budget, that's a Cabinet Secretary. Controller General is an independent, bipartisan arm of the legislature. Secretary of the of Human Resources, Secretary of DHSS. They're both Cabinet Secretaries. And then a state retiree. We're adding a state retiree appointed by the governor. So that's a new member being added. And in addition, there are going to be 2 members who are representing unions of current employees, and one's appointed by the head of the majority party in the Senate, and one's appointed by the head of the majority party in the House, Senator Pro Tem and the Speaker of the House, from a list of several of these organizations. So this added, so it used to be, see, the governor was doing that. At this point, we've got a new member, a state retiree, never used to be on the SEBC, appointed by the governor, and then the 2 union leader appointed from the employee unions are now appointed by legislative leaders. And then there's various stuff on the terms. So it has 1 new person, and it changes who's appointing the people from the unions. So that's one change, 1 additional person. It's not a gigantic change. It's a change, however. And then the second is here, the sentence that begins appointed members. So if you are appointed because of your office, let's say that you are the treasurer, let's say that you are the Secretary of Human Resources, you used to be able to attend or have your designee, maybe your chief of staff or your deputy director, attend in your place to a designee. That no longer is permitted on the SEBC. if you are on this list of being a member of the SCBC, you must yourself attend, or no one can attend in your place. It's still a public meeting. You need half the members there. So if half the members, oftentimes if someone can't make it because they're ill, they have another meeting, they have conflict, they're traveling, whatever, then their designee can come in, no longer for the SCBC. It has to be the person named. And so this legislation said this is too important to have it really essentially conducted by designees. So that's a second change that's really, that one I think is pretty significant. So those are the two big changes to the SCBC from SB 25. I think there's some additional reporting. I'm scrolling through kind of fast, but I'm just looking for underlined areas. Underlined areas are areas that were changed by this bill. So there's reporting twice a year that must come from the SCBC on their work. The reports come out by May 30th and November 30th. So that's the first part of SCBC. Now, the other piece that feeds into this is the Retiree Healthcare Review Committee, RBSC, RB Study Committee, SC, and I've been appointed to that. That was established by the governor through an executive order. That is really sunsetting. It's going away. And it's being replaced by this new subcommittee that is created by legislation, by law. And it's called the Retiree Healthcare Benefits Advisory Subcommittee, the RHBAS. I'm not sure it has any great little name to it, but let's look at its members. There are 15 members. It has the lieutenant governor, the insurance commissioner. Neither of them reports to the governor. They're independently elected. It has 3 cabinet secretaries, the director of OMB, secretary of finance, and secretary of human resources. It then has four members from the legislature, one from each of the 4 caucuses, again, Republican and Democrat, House and Senate. They do not answer to the governor. The governor shall then appoint 3 retired state employees, one from each county. So we had 3 cabinet secretaries and we had 3 retirees. So now the governor has 6 of the people that he appoints. And then we have 2 additional union representatives appointed by the head of the Senate and head of the House of Representatives, again, not answering to the governor. So what you have, if my math, maybe that was the other one. So if we look here, we've got 1, 2, I did it. Okay, 1. Okay, so we've got a total of 15 members. And of those 15 members, we've got 7 of them, or less than majority, are appointed by the governor. The cabinet secretaries, the 3 retirees from each of the counties, and I think 1 additional. So a majority come from an office such as lieutenant governor, insurance commissioner, 4 members of the legislature, and then 2 union representatives named by the leaders of the legislature. So just the makeup is I'm going to say is a balance that is more broad than it was for the SCBC. And it is chaired by the lieutenant governor, and the majority caucuses, in this case, the House Democrats and and the Senate Democrats, the member for each of those caucuses shall serve as vice chair. I'm expecting to be named to it, but it hasn't happened thus far. But presumably next few days we will see that. So it's led by the lieutenant governor and 2 legislators, not by any one of the governor's cabinet. So that's a different format. And then it's doing public meetings, and the charge is to explore, to get input. But the main thing is it is providing analysis and recommendations to the SCBC. It's reviewing the past. It's conducting and receiving public comment from the present, and making recommendations going forward, including evaluating the possible extension of the existing Medicare supplement plan. Look at all the options. Issue an update findings. This is not the end. This is just by May 1st, this new subcommittee must issue its findings and recommendations to the governor and the General Assembly as it relates to the upcoming budget. And so that's the bill. So it is. I've would characterize it as it's taken a subcommittee that was created by the governor, and it has replaced it with one that has, in my eyes, better balance. And it is also has a wide mandate. It's not narrow. It's not just rubber stamp this or that. So that's my way of saying I voted for it, and it became law. So let's see. Okay. The first thing, Joan, well, thank you for your thanks. Slide said current employees fund retiree health policy costs out. So, so I'm sorry, I'm reading your question out to myself. So I think we're looking at this one, not that one. I think we're looking at that one there. And so the what I was pointing at is current employees. You can look at this bottom one. Current employees pay 21.7% of the cost of premiums. So that is where they fund. So that's where they fund the current now. So you're asking about how they're funding the future. So this column on the right is how, if we chose to put some of the burden of closing the gap between our liabilities and our trust fund, if we want to have some of that covered by current employees, you know what? I'm talking about this and you can't see what I'm talking about on this right column. So this right column is how we could put it on active employees. So if we charge current retirees more for the healthcare premiums of their spouses, that would be one way to reduce the gap between the liability and the trust fund. If we change the vesting, so it took more years of service before you receive, you're eligible for as high a share of retiree healthcare, that'd be another way of putting a greater burden on the current employees to narrow that gap. We could have a minimum age to enroll in retiree medical plans. This is something that just is amazing to me. If you start working full-time for the state at age 18 and you put 30 years in, and so you're now 48 years of age, you can get, my understanding is you can get full retiree health benefits. You are decades away from being eligible for Medicare, but the state's responsible for your health care at that point because you're 30 years in service. That is something that a lot of employers do not provide. That they provide starting at 60, 62, 65 retiree health benefits, not just when you have 30 years in. So if we were to change that, that would take some of the liability away from the state plan. That would bring the liability line down a little bit closer and therefore reduce the gap without changing the money going in. Eliminating the ability to access retiree medical benefits for vested employees that terminate the state service prior to being eligible to retire. So this again is for people who retire early and may have another job or two to work before they get to Medicare age of age 65, not having the state obligated to pay for the health benefits until they become Medicare eligible. And Employee Benefits Modernization Survey of February 2023. So under this column, and this last bullet is not how we're going to, it is not a concrete way to narrow the gap, but rather it says that starting next month, the state is putting a survey out to its current employees and perhaps to its retirees. I'm not certain. Sorry about that. To find out what's important to them. And it may be choice, and it may be making sure there's no out-of-pocket cost for premiums, and it may be whatever else. It may be no prior authorization. It can be an awful lot of things. Maybe it wants a Silver Sneakers program. Maybe it really likes, I know I'm talking fast. Maybe the respondent really likes the prescription drug program that the state has, or maybe they really hate the prescription drug program they have. That survey will help the new RBSC and can help the SCBC understand what is desired by current employees and perhaps also by retirees. All right. Some retirees do pay all or part of the premiums. Yes, indeed. This 0.6%, there we go, that one there, 0.4%. Retirees who did not have as many years of state service are responsible for paying a portion of their health benefits. I, at this point, have just over 10 years, and I'm nowhere near eligible for 100% payment of the premiums. It would be on my shoulders when I retire and when I'm of Medicare age. If I'm eligible at all. I don't, frankly, I don't keep track of that right now. But indeed, but most of the people who are receiving retiree healthcare benefits from the state are ones who've had enough years that they're paying a very small, they're paying no amount of their premium. When you take for all 30,000 people and the portion of those who do pay a share, it works out to be a very, very small percentage, as you can see there. Depends how long they worked and particular union contract. Yep, absolutely. Okay, so Joan, you are giving me great questions. How are current employees now funding retirement? Okay, I think we hit that one. And that's the slide. It says active employees subsidize retiree costs. How? So, Joan, I hope that my rambling. Okay, so amount covered by premiums. Right. Subsidized healthcare costs for state pensioners. And Joan, I am going to agree with you that I'm not sure you can see my the words oh, you can look at this. The words here. I can't say that I agree 100% that they're accurate. But what there is. I think is the GHIP, the General Health Insurance Plan, whatever. I think that there are some measurements that look at both active and retired employees as one pool, and to the extent that active employees' premiums go into that pool and all healthcare costs and outgoing premiums come out of that pool, if active employees are paying more for their premiums, that can also serve to shrink the gap. I'm just plain not in a position at this moment to definitively and authoritatively say that that's accurate or inaccurate. But thank you for asking. Choosing. Okay, so from the state retiree, what's the procedure for choosing the 3 members to the new SBC from state retirees? The new SBC, the new RBSC, the new study committee. So when any member, and I'm going to jump now to the bill. That's not the bill. That's the bill. So if we go back and let's look at the study committee. So the advisory subcommittee. Anyone who is appointed by. So at this point, let's take the Speaker of the House. He's the first one indicated who is appointing a member of this advisory subcommittee. Speaker Pete Schwarzkopf can choose any retiree. There's no guidelines for that, and that's what's written in a whole lot of legislation that sets up task forces, boards, commissions, etc. And then the governor, for instance, has to choose a retired state employee from each county. There is no preset procedure for that. I have sent emails to the governor's office with a list that I received from an organization who's very interested in this. Perhaps you've heard of it. And there's nothing stopping anyone from sending an email to the governor's office or to the speaker or to the senator pro tem. They're the 3 individuals who have appointing powers for this subcommittee and or for the SABC itself as a result of this law. So the process is when they feel that they are ready, they will officially send a notification on letterhead. Well, first thing is they will most likely speak to the person first and say, "Are you willing to serve?" And the person says yes. And then the appointing person will say, "Okay, I'll put it on letterhead that I have appointed Jane Doe as my Kent County retiree." And then we'll send that to the chair, the lieutenant governor. We'll send it likely to the clerk of the House, clerk of the Senate, some other entities that keep track of all these things. So I hope that answers the process and procedure. To the extent that the statement is accurate, my guess is that they are talking about payroll taxes for Medicare now. I don't think so. I'm sorry, Joan. and by that, I'm not repeating the questions because they are in the chat. So I'm hoping that you can review the chat, and then my comments will seem less out of left field. Back to that slide of active employees subsidized healthcare costs for state pensioners. It is true that current workers have Medicare taxes that come out of their paycheck, and the way that the Medicare system is run largely, it is incorrectly, but I understand it, describes a Ponzi scheme where current employees pay money in and it's withdrawn by retired individuals, beneficiaries of Medicare, current beneficiaries of Medicare. And then, I'm a current worker, so part of my wages goes to the Medicare system that goes and pays the current retirees who are on Medicare. And when I'm retired, I'm hoping I've got some nice youngins who are then current workers, and they get Medicare taxes come out and pay for my benefits. So there is that, but I don't think that's what this phrase that I have sort of highlighted here is referring to. I think it has to do with premiums paid into the state health system that then pays out for current health claims of eligible individuals, both current and retired individuals. That's my belief. Okay, so okay, here we go. That's what I meant. Your interest paying for retiree healthcare similar to Medicare. Yeah, I'm not sure this is an improvement. I'm going to say it's less of a Ponzi scheme and more of a shell game. And maybe that's a distinction without a difference. But yes, the system is such that the current system is pay-go, where money comes in and money goes out. And if the premiums don't cover the outgo, the state has to make up the difference each year. So that's, there's a, you borrow from Peter to pay Paul, something like that. Different Paul. Sorry. So there's that, but I think the state's really talking about, well, in this thing, the premiums come in from the retirees, and then from the current employees and from some retirees. Money comes in, Medicare pays for the stuff that Medicare covers, and then the stuff that doesn't through the MedicFill is paid by Highmark on behalf of the state, and the state pays the money to Highmark to cover that. And when those costs are above what it receives in premiums, well, then the state has to put that into the budget, which is where that $192 million budgeted for next year it would be going. All right. Okay, so I didn't realize we have two Jones who are providing great questions. So the next steps is, I'm very laser focused on the study committee, this advisory subcommittee. So, and I've already been working with the presumed vice chair from the Senate and the lieutenant governor, urging us to get this set up as swiftly as possible. I'm hoping for the first public meeting to be in February. I'm led to believe that we may have meetings as frequently as every 2 weeks. One thing I want to bring up, and I mentioned this at the last Facebook Live, is we have, that's not the one I want. Where do I want to get? So let's just get that guy quiet. That's the one. Okay. So there we go. So let's go to that one. So the State Employee Benefit Committee, and I Googled Delaware Public Meeting Calendar, clicked on it, and I put in SEBC under search for, and I chose the year 2023. They have monthly meetings on the third Monday of the month at 2 p.m., both in person and live streamed, I believe, and it also has subcommittees. You'll notice that the Retirement Benefit Study Subcommittee is not in there. And one of the reasons is they knew SB 29 was filed, was being debated and considered, and it essentially is being disbanded by the presence of SB 29 and the new Study Advisory Subcommittee. Once those meetings are beginning, they'll be noticed here in the same place. You can look for it. I will be on this Facebook page sharing when there's SEBC meetings, when there's advisory subcommittee meetings. And I do want to point out that in February, the 13th, maybe it's the second Monday, the 13th at 10 sorry, that's the wrong one, SEBC. SEBC, February 20th, there it is, the third Monday at 2 p.m. is the next meeting of the SEBC. Usually, a few days ahead of time, they'll have a preliminary agenda and meeting materials, but often the meeting materials are updated the morning of the meeting, maybe even at the time of the meeting, 1 or 2 o'clock in the afternoon. And that will have the agenda, will have all the presentation materials that they have ahead of time that you can pull down and have up on your own screen to view. So I'll share that information when it becomes available. And again, when the advisory subcommittee gets filled with its appointees, then the vice chair is responsible for the chair is responsible for choosing the date, time, and location of the meetings. And we'll start announcing them. We'll fill the public calendar website with when and where those meetings are, and we'll get the public notice out, and you'll find out more. All of these meetings, Carol, great question. All of these meetings are open to the public, both in person and virtually. All of these meetings will have opportunities for public comment. And that's what I keep pointing out in my emails to people who reach out about SB 29 and being frustrated that it didn't do more. I say this SB 29, I really want to echo comments made by Senator Marie Pinckney at the Senate Executive Committee open hearing on SB 29. She said, this is not the last step by the legislature. This is a first step by the legislature. So SB 29 is designed to add a little more representation to the SEBC and to establish a legislatively drawn up study subcommittee, and with a nice broad membership and a broad charter, and ensure that both of these are public bodies and therefore meetings are open to the public, opportunities for public comment. That's explicitly stated in SB 29 for the advisory subcommittee. So the next step is to get that subcommittee filled with the names of people, and because we need to have 8 of those, because it's a 15-member subcommittee, 8 of those there to conduct any decisions. So we want to make sure that we work with them and find days and times that work and get them on their calendars. They can all be there, or at least as many as we can get there. Among other things, it's important for them to see the material and also to hear from the public. All right, numbers on what the annual cost of the state would be for proposed Medicare Advantage program versus the current program. So, Joan, that's a great question. And I have I can find the materials from the RBSC when they reviewed that in the past. And they reviewed explicitly what the savings would come from shifting from Medicare to Medicare Advantage. But in a sense, I view SB 29, the new advisory subcommittee, as having a clean slate. And I'd rather look at fresh data in rather than last year or the year before's data. It is all available online. All the past stuff is out there. But I don't think that the advisory subcommittee is going to be making decisions based on past presentations. It is charged in the bill language to look at the material from the study committee. That's actually part of the bill. But I can't quote that offhand. I don't have that handy. But there was a preliminary and a final report from the RBSC, and it had a bit of analysis of what the savings would be. So let me just pull up this thing. Okay. Take into consideration the previous work of the SEBC and the RBSC. So indeed, the subcommittee has these duties and functions. Joan, I will try. So I'm going to try. Right, I'm going to try to hold this in 2 weeks. Maybe not at the same time. I'm going to try to hold this in 2 weeks, and I will try to have that material, the past material from the RBSC, both at least its final report with the savings that it was looking at that time. But again, that data is that's a year old, so I'm hoping to have more current data that the advisory subcommittee will be able to review. You have my email. That was the first comment in this thread. If you have any follow-up questions, please do not hesitate to share them there. I will do my best. I'm trying to keep the public aware of these happenings. I'm working to make sure that RISE in particular is aware of public meetings and public material. And I'm working hard to make sure that my House Democratic colleagues are kept apprised of what's going on, so that they can better field questions and concerns from their constituents, since I'm a representative from the House Democratic Caucus. I'm not seeing any more questions. It's been a half hour, and I think the Eagles are still playing. So if you don't mind, so yes, I will absolutely post the link to the meeting schedule when it is available. I'll be doing things on Facebook. I'll be doing things through eBlast, an email blast next Monday, I believe. I have my coffee on Wednesday the 8th, and I'm certain we'll be talking about this some. But also Facebook link. I'm sorry. And then the one I plan to present this on either Saturday the 11th or Sunday the 12th, another Facebook Live, assuming that we've got some updated material. I'm hoping by then we've got the subcommittee formed, and I'd be really pleased if we had a schedule of meetings defined by then. If we have really important stuff that comes out before that, then I'll work on making material available sooner. And that seems to be the end of the questions. So with that, I would like to thank all of you for tuning in, and hope you have a great end of the day. Indeed. I think you can sort of conclude that since I had forgotten when the Eagles game was when I scheduled this, that I'm not highly invested in today's results. I'm more of a Super Bowl watcher than throughout the season. But we'll see how it goes. And I know that a spoiler alert, at least when we came in, there was good news for Philadelphia fans. So with that, I will end today and wish you all a very good week. Take care.